something so I could make.
Okay, so there we go. All right, so I'm admitting everyone. Hello, folks. Welcome. We're going to wait a few more minutes as all the different people join us. Thank you for joining us. We ask that you stay muted and off screen. As we get started. One more minute. Okay, so we are recording. And so I am honored. My name is Jocelyn Foye. I'm the executive director of the Woman Project. I'm honored to be joined by Congressman Magaziner and Nina Harrison from the Economic Progress Institute. We were able to convene this quick meeting due to the extreme change in tides as everything seems to be happening in the United States at the moment and how it affects Rhode Island. And what two wonderful people to be speaking to us today on tax day around some of the impacts that the what is happening in Washington, D.C., as well as what is happening in Rhode Island could have on all of us. So just as a quick heads up, like how we're going to do this, as I do a further brief introduction, we're going to ask the congressman to speak about 10 minutes to us around what he's seeing and about around the recent major votes that happened in Congress around the budget. Then we're going to pivot to Nina Harrison, who's going to talk about some of the different actions that are happening through the revenue for Rhode Island and the Protect Healthcare America Now. Sorry, I'm muddying that up. Protect. Wow, I had a brain block. Protect Our Healthcare Coalition, and what kind of bills that we're working on in coalition so that we can move on together and make a larger impact as a community. And we'll wrap it up with a few questions. If you have them, please drop them in the chat and we will add those here. So to that end, I'm going to let you speak first, Congressman. Then Nina and I will start. I will finish with the introductions, and then we'll go to some question and answers. So take it away. Oh, you're on. Hold on one second. You're unmuted. You need to be unmuted. There we go.
Thank you, Jocelyn. Thank you for convening us. This is a really important topic and exactly the right time for us to be talking about it. And thank you for all the work that you and your colleagues at the WIN Project are doing. And also Nina and EPI, thank you for your incredible work. The data and information that you produce was useful to me when I was state treasurer. It's useful to me now, and I'm very grateful to you for it. So I thought what I'd do with my opening few minutes here is just explain a little bit about like what is exactly going on with this budget and tax bill that I know it feels like we've been hearing about for months. And it's a convoluted process, and there are lots of votes, and like what does it all actually mean? So what we're here to talk about is essentially the Trump and congressional Republican tax cut plan. So President Trump made a lot of promises during the campaign about tax cuts. He promised to extend all of the tax cuts he passed in 2016, most of which either have expired or are about to expire. And those tax cuts, just for those of you who don't recall, in 2016, I'd say it was a mixed bag, but largely, by and large, those 2016 tax cuts benefited the very wealthy and big corporations, especially the very wealthy living in red states. There were arguably, if you are a wealthy person living in a blue state, you were worse off as a result of the 2016 tax cuts. If you're living in a red state where they don't have a state income tax, you definitely made out really well. So he wants to extend all of those 2016 tax cuts, which were going to expire. That would cost something like $4.5 trillion over 10 years. In addition to that, President Trump made a lot of other promises. He promised to get rid of taxes on tips, which that one actually sounds pretty good to me if you can figure out a responsible way to pay for it. He promised getting rid of taxes on retirement income and Social Security, which again sounds good, but would be enormously expensive. And of course, he had no plan for how to pay for it. And then, well, I'll stop there. So those are the tax cut promises that he made. If we were going to do all of those things, it would cost about $6 trillion over 10 years. Now, here's where we get into the process. So in the US Senate, they have the filibuster. It takes 60 votes to pass anything. But there is an exception to the filibuster. It's called the Byrd Rule. And the Byrd Rule says you can pass something with just a simple 50 vote majority if it is a deficit neutral budget. And so that's what the Republicans are trying to do. They're trying to use this Byrd Rule so they only need 50 votes, not 60, and to pass the tax cuts. But in order to do that, they need to cut the budget in order to have the tax cut plan be budget neutral. So that's what they're trying to do. And there's a couple of steps in the process. So the steps that have already happened is the House and the Senate pass a bill, which is basically a plan, and they say to each committee in Congress, here is your target for how much to cut. And so they say to the Natural Resources Committee, cut this many billion. They say to the Energy and Commerce Committee, cut that many billion. They can also give committees an assignment to increase funding. So, for example, I'm on the Homeland Security Committee. They gave us a target to increase funding because they actually want to spend more money on the border at the same time that they're doing all these tax cuts. So, where we are in the process now is they have passed this plan, and now the Republican and it's the committees, but it's really the Republicans on the committees because they cut the Democrats out of these conversations. But each committee is working on their plan for how they're going to meet their target for cuts. And then sometime they're aiming for sometime in May, they're going to unveil all of their plans for cuts in order to pay for the tax cuts that Donald Trump and the Republicans want. So we haven't actually seen that plan for all the cuts, but we can make some educated guesses about what they want to cut based on the targets that they gave to each committee. And the big one, and the one that I imagine we'll spend most of our time talking about this morning, is cuts to Medicaid. So the four biggest funding, like the four biggest programs that the federal government funds are Social Security, Medicare, Medicaid, and defense. And Trump and the Republicans have basically taken Social Security, Medicare, and defense off the table, or at least they claim they have. We won't know for sure until we see the final plan that they come out with in May. But that basically just leaves Medicaid of the big budget items. And so they've given the Energy and Commerce Committee, which oversees Medicaid, a target to cut $880 billion. Presumably, that will almost all come from Medicaid because that's the big program that Energy and Commerce oversees. So what would an $880 billion cut to Medicaid mean? Well, it would be absolutely devastating. Medicaid covers something like 75 million Americans. That is their source of health insurance, including about 250,000 Rhode Islanders. And these are primarily lower to like middle income individuals who would have a very hard time affording health insurance otherwise. Why are the Republicans choosing to go after Medicaid as their big ticket item to cut? It's because they're making a bet that, hey, senior citizens vote in high numbers, so we're not going to touch Social Security or Medicare, but lower income people vote in lower numbers, so we might be able to get away with making big cuts to Medicaid. That is the cynical political calculation that Trump and the Republicans are making. What I think they're not taking into account is a couple of things. Number one, it's not just very low income people on Medicaid. There are a lot of middle income people who are on Medicaid, especially post Obamacare, because Obamacare expanded Medicaid eligibility to a lot of people. Second, when you make big cuts to Medicaid, you're not just hurting people who are on Medicaid, you are also hurting the healthcare providers for whom Medicaid is a big source of their revenue. So hospitals are going to take a huge financial hit. Community health centers, behavioral health centers, nursing homes. And so you could be someone, maybe you and everyone else in your family is not on Medicaid, but you have a family member who's in a nursing home. That family member's nursing home could still shut down because of the big Medicaid cuts. Maybe you're not on Medicaid, but you go to Thunder Mist or Wood River Health as your primary health provider, and you may not be on Medicaid yourself, but Medicaid is a huge part of their budgets. And so huge cuts to Medicaid could mean that those providers shut down. And so what I think the Republicans haven't realized is that all across the country, there are going to be hospitals and rural health centers, community health centers, and nursing homes that will not be able to stay open if they go forward with these big Medicaid cuts. And so, with the last 2 minutes I have here, here's where things stand and where I think things are going. So, the politics is this: Republicans have only a 4-seat majority in the House. It's a very narrow majority. And in the Senate, it's also a 4-seat majority, but a smaller chamber. So effectively, it's a bigger majority in the Senate. And I would say there are about 15 or 20 Republicans in the House who come from purple districts who understand that if they go forward with huge cuts to Medicaid, it could really hurt their reelection chances. And so there are like 20 or so Republican, I won't call them moderates because like none of them are moderates anymore, but they're swing state members, they're swing district members who are smart enough to be nervous about this. On the other hand, they're also nervous that if they don't go along with it, they'll get primaried and that Elon Musk will dump millions of dollars into funding a primary challenger against them. So they're all going through that calculation right now. At the same time, you have like the Freedom Caucus and the far right who are very insistent on moving forward with the whole package. And if they don't, then they're threatening that they might, overthrow the speaker or something like that. Um, but I think the cracks are starting to show. I think that some of these swing district members are starting to come to the conclusion that it would be worse for them to have big Medicaid cuts than not. And I don't want to count our chickens before they hatch. I don't want to sound overconfident, but I would say that just the buzz I'm hearing is that more and more of those swing district members are going to their leadership saying, "Hey, we really got to be careful there." And and I think there's 3 ways this could go. And then I'll end with this. One way is they plow ahead and Trump and Musk put the screws on the vulnerable Republicans and they fall in line and they make huge cuts to Medicaid and SNAP, which we should also talk about in other programs, in order to pay for their tax cuts, and it'll be absolutely devastating. Millions of people get hurt. It would be bad. That's one possibility. Another possibility is that they could decide to do what Republicans have done in the past and pass their tax cuts without big spending cuts and just explode the deficit. That is also possible. Now, how can they do that and get around the Byrd rule in the Senate? Like they could do it by using like fuzzy math. And so you might hear these phrases get thrown around like current policy baseline or inflated growth assumptions, but they might use fuzzy math to just do the tax cuts and blow up the deficit. Um, that's a possibility. The Freedom Caucus people would hate that, but maybe the Freedom Caucus people will get rolled. We'll see. The third possibility, I think this is the least likely, but it's not impossible. I would give this one like a 5 to 10% chance, is they could say, okay, let's take a step back here. Let's do the tax cuts only for middle and like the middle class. Like forget about extending the tax cuts for the rich. Let's just do no tax on tips and let's just do stuff that will actually help working people. And then we don't need to cut as much because it'll be much less expensive and do it that way. That would obviously be the best outcome. That is a very big departure from what Republicans have historically done. So I think that's less likely, but I will say there are some voices in MAGA world, like Steve Bannon and Josh Hawley, who are actually calling for this and are saying, hey, if we, the Republicans, are going to be the party of the working class now, like let's actually do it and let's forget about the tax cuts for the rich and just focus the tax cuts on the middle class, and then we don't have to cut so much. I think that's still the least likely outcome, but it's not impossible. And obviously, for those of us who care about the outcome, that would be the best outcome. So that's where we are. I think we'll have more clarity in May when we actually see what plan they come out with. But in the meantime, what we can do is all continue to be as vocal as we can. No cuts to Medicaid, no cuts to SNAP. We have to protect these programs. We have to sound the alarm. And I'll stop there.
Thank you, Congressman Magaziner. Um, So, as Jocelyn mentioned, my name is Nina Harrison, Policy Director at EPI, the Economic Progress Institute. And some of the things we've been working on in relation to what you just spoke about, first and foremost, is trying to address the budget deficit here that we have in the state of Rhode Island, which is upwards of $220 million, and also trying to make sure that we can bring in enough revenue to not only plug that budget deficit, but also to be able to protect and shield Rhode Islanders from any potential cuts to federal funding to Medicaid or SNAP, which we are all fighting against. And thank you for the work that you're doing to fight those cuts in DC. So the bill that we've been championing through the Economic Progress Institute and also through the Revenue for Rhode Islanders Coalition is a bill to tax the top 1% of income earners in Rhode Island. And those are only people who are earning more than $625,000 per year. And that's after all deductions. So I think there are a lot of misperceptions and maybe some even fears from some people about this bill, but it has tremendous support in the community because the reality is people do not want to see critical programs cut. They don't want to see funding cuts for RIPTA. They don't want to lose their health care. And so this bill to tax the top 1% would raise $190 million annually for the state of Rhode Island. It's currently in the General Assembly, House Bill 5473 and Senate Bill S329, and it would only affect 5,700 tax filers. So essentially, the Revenue for Rhode Islanders Coalition is saying, let's raise this revenue for Rhode Islanders. Let's prioritize the needs of 1 million Rhode Islanders over preferential treatment for 5,700 tax filers. And again, this would not touch the first $625,000 in income. And as Congressman Magaziner mentioned, many people in this income category have received some serious tax cuts through Trump's first tax cut for the wealthy. And so in many instances, the tax cuts they've received federally would offset any increase to taxes here in Rhode Island via that tax on the top 1%. So again, with a more than $200 million state budget deficit, this bill, which would raise $190 million annually, could really go a long way to protecting the critical services that Rhode Islanders are relying on and to provide some insurance in the event that there are any cuts to Medicaid or SNAP. And according to our research, approximately 1/3 of Rhode Islanders receive their health coverage through Medicaid, over 320,000 people, and approximately half of all children in Rhode Island. So it's a serious threat that we're hearing about, and it would be nearly impossible for Rhode Island to plug that funding gap if these cuts were to happen without raising revenue. So it's really imperative that we pass this bill. And there are other measures being proposed as well to raise revenue in Rhode Island, including a proposed tax on non-owner occupied second homes, i.e. vacation homes, many of which are owned by people who live primarily out of state. So again, in that instance, it would primarily or could be primarily be affecting people who live outside of Rhode Island, but would generate serious revenue for our state. And another thing that we have been championing specifically as it relates to healthcare and threats to healthcare in Rhode Island is the Rhode Island Individual Market Affordability Act. And essentially, this is designed to help people who do not qualify for Medicaid, but are access and do not get health coverage through their employer. So instead, they are purchasing health insurance through HealthSource RI. And in 2021, Congress passed enhanced premium tax credits to help these people just over the Medicaid limit be able to afford health insurance, particularly during the pandemic. And thank you again for that, Congressman Magaziner. Unfortunately, those tax credits are set to expire this year. And what that means is that about 46,000 Rhode Islanders are going to lose subsidies that were helping them pay for their health insurance, and they will see an average increase to their healthcare premiums of about 85%. And for many Rhode Islanders who are already struggling to meet their basic needs, an 85% increase in their healthcare premium is just not sustainable. And for some people, that increase will be much higher, up to 200%. And so this Rhode Island Individual Market Affordability Act is a proposal to essentially replace those subsidies at the state level, to create a state subsidy that would allow these people to continue having their healthcare coverage without seeing those steep increases in premiums. And that would be paid for not by general revenue funds, but by a small 1% assessment on all insurance companies. And that way, those 46,000 Rhode Islanders would be protected. So we're very much championing proposals like the tax on the top 1% to raise the revenue that we need. We're trying to come up with other proposals like the Rhode Island Individual Market Affordability Act to protect the tremendous gains that Rhode Island has made in terms of access to affordable health care. I'm really proud of our state. We have one of the lowest rates of uninsured people in the country, and we certainly don't want to lose all of that progress because we haven't raised sufficient revenue when there's an easy means to do so, and or because we let a terrific program like enhanced premium tax credits expire without anything to replace it. And so we're really hoping to call people to action, and I think there's a lot of appetite for that in the community. We've seen great turnout at protests that are really speaking about all of these issues, protecting Medicaid, protecting SNAP, and taxing the rich, trying to restore some justice and fairness to Rhode Island.
Thank you so much, Nina and Congressman. So my piece is the last piece that sort of rounds out a little bit of a discussion with a report at the end, and then we will go into some questions. Please drop them in if you have them, but there's also a few questions that they're prompted with already. So I'm here because the Woman Project was founded to defend bodily freedom, and we worked really aggressively to defend abortion access from 2017 to about 2024. And the Equality Abortion Coverage Act included the insurance coverage for low-income people to have access to this essential health care that is life-saving. And we believe that no health care should be taken off the table and that all need to be included, not just some. But we come back to this idea that bodily freedom is what we're talking about today and in so many cases. And ultimately, so much of this is at risk for millions of Americans, including 150,000 Rhode Islanders. So I'm going to repeat a few of the numbers because I think they're so important for us to understand. President Trump and the Republicans in Congress are moving to take away, obviously, this affordable health coverage for 80 million people. These are seniors, children, working families, people with disabilities, and veterans by slashing Medicaid and the Affordable Care Act, all to give trillions of dollars to tax breaks to billionaires. And this is 2 in 5 of them are all at birth. So of the 80 million, this includes 2 in 5 of all births, 2 in 5 children, 1 in 6 non-elderly adults, 2 in 5 non-elderly adults with a disability, and 3 in 5 nursing facilities. So another 800,000 people in Rhode Island get their health coverage through the Affordable Care Act, which we were just talking about with this Medicaid expansion. And with Republicans wanting to cut that in Congress, they're proposing to eliminate the entirety of it with premiums and points of working people won't be able to afford them. So by asking Congressman Magaziner and Nina to come, the Woman Project often looks for roles and ways to get involved, ways to put information in front of us to be better informed, and things that we can do about it. So we're releasing a report today prepared by ourselves, the American for Tax Fairness and the Healthcare for America Now, showing that Rhode Island's wealthiest residents can and should pay for more of their fair share. The Rhode Island households with income of $1 million or more, the highest income residents in this state, have seen their annual income grow by $2.6 billion or 76%. From $3.4 billion to $6 billion since the enactment of the original Trump GOP tax law in 2017. So I'm going to share this report. This will give you data on who those people are, how much money they are making. It'll give us the information we all need to act from. And I think that it is imperative that we are in front of the information, the data, and the data informs a lot of our actions as well. So I'm going to end my piece by just saying this message today obviously is very simple, and we're honored to be in the company of these folks. We don't want to take away anyone's health care. We don't want the unhoused, the unhealthy. We want everyone to have access to essential health care and all health care that they deem is necessary for themselves to live in bodily freedom, and everyone is paying their fair share in doing that. So thank you for letting me round out my little piece. So I'm gonna send it to you, Congressman. And I think that we have a unique situation. You were the former treasurer of our state, so you know so much more in a different way. And I think that that really presents like a gift for us to feel like we can understand from you better. And I've also say as an individual, you've always spoken in ways that are not over my head. You've made it possible to understand some of the very technical things. So my one of my questions I've asked you prior is, as the former treasurer, where do you see we as a community, as a state, can move from this moment in creating a more sustainable future with the potential of massive financial shortfalls to our funding from the federal government?
Can you hear me now? Okay. So, let me say a couple things. First of all, 110% of my focus right now is on doing everything that I can to stop these Medicaid cuts from happening and SNAP cuts as well, which is the second biggest thing they're going after. And there's a role for all of us to play in that. Because if we can win that battle or at least make it less bad over the next few weeks, then it'll make the state level stuff so much easier. So me and the rest of the Rhode Island delegation, almost every day, we have a press conference or some sort of event just about Medicaid. Like we've done Medicaid events at hospitals, community health centers, nursing homes. I'm doing one this week focused specifically on the impact of the developmentally disabled community. And so like Zooms like this one, events, trying to get media coverage of how devastating these Medicaid cuts would be, that is something that we all can participate in. Rallies, events, town halls. And I also always say, like, be loud online too. Like, people used to say, oh, social media is not real life. Yes, it is. Like, yes, it is now. That is where 40% of people get their news from. And so all of us can use our platforms. And the goal is to make four of those Republicans feel enough pressure that they back off. Now, as far as if we're not successful or if we're only partially successful, what does that mean at the state level? I'll say, first of all, I really do not envy the General Assembly and the current governor and state treasurer for this because this is a really tough situation for them. When I was state treasurer, the last couple of years we were running surpluses, but even in the like years following the Great Recession, we might have a deficit of like 300 million that we needed to fill. At this point, as Nina said, if these Medicaid cuts go through, then the existing $300 million deficit will turn into a probably $500 or $600 million deficit, which is enormous in the context of the state budget. And the state is then going to have a series of decisions to make. They would either have to kick a bunch of people off of Medicaid or reduce the services, the health services that Medicaid covers, or make other cuts to the budget or raise revenue. Like those are the only ways that you plug the hole. And I think that state leaders right now are being smart in keeping their powder dry and not making a bunch of commitments to either cut taxes or increase spending or do anything else until we at least know what the lay of the land is, like until they at least know what they're working with. I also think that state leaders are being smart not to take anything off the table. I've been watching Speaker Shikarchi, like all of his predecessors for many years, any tax increases on high earners were off the table. This year, he's saying something different. He's saying, you know, we're not taking anything off the table because we don't know what we're working with. Um, Same with new spending obligations. Like, believe me, when I was state treasurer, and even now, I have a whole long list of things that I would love to see the state do. I'd love to see universal child care and free college and all the rest. But I think, unfortunately, state leaders are right that they have to be cautious these next couple months, again, until we know what we're working with from the federal government. So I don't envy them. And I hope that we'll be able to stop a lot of these Medicaid cuts from happening or all of these Medicaid cuts from happening in Washington. But in the absence of that, I think that state leaders are doing the right thing and being cautious and not making commitments and not taking anything off the table because we don't know what the world's going to look like a month from now.
Thank you, and yikes, of course. I don't know how to follow that with anything other than okay. So, Nina, I'm going to pass it to you and to ask the question, how, you are a lobbyist, you are a strategist, you speak to a lot of people in the Rhode Island State House around a number of these issues that the Congressman's speaking to. Do you see a lot of support in the legislature for the bills that you spoke on, as well as just over the overarching umbrella of it all?
I think the short answer is yes. Um, I think among the General Assembly, the Rhode Island General Assembly, there is a lot of support for the bill to tax the top 1%. I think both in the House and the Senate, among the legislators themselves. I think leadership in the House and Senate has taken a little bit of different tacks in terms of how they've responded publicly to questions about this bill that could raise $190 million for the state. As Congressman Magaziner mentioned, the Speaker Shekarchi, has been more open-minded and has been willing to discuss this and hear us out on it, which I very much appreciate. And whereas the Senate president has said in the press that he thinks this is potentially foolish. And so we've been seeking meetings with Senate leadership to help essentially disabuse them of any myths and misperceptions they may have about the bill, because from our perspective, and I think this perspective of the overwhelming majority of Rhode Islanders, is that this bill is a good thing. It's a low impact in terms of only affecting 5,700 tax filers, and it's sorely needed. Not just to plug the budget deficits, but also to make our tax system more fair and equitable. And so I think most of the legislators who I speak with, the senators and the members of the House, uh, are very much in support of this. And I think all legislators are in a tough spot right now in terms of feeling the stress of these budget constraints. And we've yet to mention on this call that we still have a bridge that needs to be repaired, and that's going to be costly as well. So I do think it's in the best interest of everyone, and I do think there is a lot of support, even among the Rhode Island General Assembly, for this bill, and certainly in the community, which, frankly, I think the community, from what I've heard, would like the bill to be even more ambitious. But I think that we've arrived at something that we think is fair and really could be similarly successful to what they did in Massachusetts in terms of they've raised, I think, more than $2 billion now from the millionaires tax that they passed. And they're beginning to make their buses free and do all kinds of things that we would hope to do in Rhode Island. Um, so I'm definitely seeing support for that. In terms of the marketplace affordability bill to help people who would be losing their enhanced premium tax credits. I think that's a new concept to many people, and I think it's harder for them to wrap their head around, and perhaps getting a little bit less attention when eight hundreds of billions of dollars in cuts to Medicaid is a much scarier prospect. But I still think that there is very much interest, especially from legislators who are longtime champions of healthcare and access to affordable healthcare.
I want to take an opportunity to say thank you to the legislators that are here. You have a number in your chat. So thank you to all of you who have made time to come, as well as the work you're continuing to do, because I recognize you're up a steep hill, but we're hoping to help as much as we can. Congressman, you have a question in the chat that is from a friend of mine, Ryan Fontaine at Thunder Mist. And she asks, I'm a transgender Rhode Islander and a healthcare worker. What are the Rhode Island delegation and other Democrats doing to prevent bans on healthcare for transgender people, particularly if the Republicans need to telegraph a quote unquote win coming out of the budget fight? We've already seen trans people sacrificed in spending bills this session.
Yeah, thank you for the question. And unfortunately, it's a very timely one also because Speaker Johnson in particular seems to be obsessed with denying people access to gender affirming care. I will say, whenever Republicans put out a standalone ban on gender affirming care. Every Democrat votes against it. I've signed on to, and I think every member of the Rhode Island delegation has signed on to legislation that would codify access to gender affirming care. Obviously, under this Congress, that's not going to move, but when we take back the majority, I think it can. I don't know if they are going to try to roll something into this tax bill or not. Um, Obviously, if they do, we'll fight against it, just like we're fighting against the whole bill overall. But I wouldn't put anything past them. I wouldn't put anything past them. So I think you're right to sound the alarm. And I'll just say that if they try to roll in any sort of restriction on access to care, then we'll certainly fight back against it. As you probably know now, under Medicaid, what is covered is essentially up to the states. And in Rhode Island, we have pretty broad coverage, which is great. But could they try to put something into the bill to tell states what they can and can't cover? They might try to do that, and it'll be yet another reason for us to oppose this. I think, yeah, I mean, and so I wouldn't put anything past them.
Nina, I think it's a nice juxtaposition to that, to ask the question of, you are so much in community. You are having huge amounts of community conversations, and I know the Protect Our Healthcare Coalition is doing a lot to do storytelling for anyone who is on this chat. And I prompt this to your colleague Karen Malcolm, who's on the call, if she could drop in the link to people's storytelling around what's happening right now with their own Medicaid stories. I'm curious, what are you hearing from Rhode Islanders on day to day? You had an awesome session with Progresso Latino. I understand you've done a number of collaborations. If you could just let folks know what you're hearing on the ground.
So yeah, we recently had a community conversation with Progresso Latino and the Latino Policy Institute in Central Falls. And essentially what we are hearing is that a lot of people were having positive experiences with their Medicaid coverage. And, we had the unfortunate job of telling them that these are some of the programs that may disappear, like in-person translation services, or being able to get rides to their doctor's appointments, are some of the services that may disappear if Medicaid funding were cut. And so what we're hearing is people are having primarily positive experiences with Medicaid. And of course, there are always improvements that can be made. Maybe they were wanting more translators and more in-person translation services and things like that. We also have a primary care physician shortage in the state. And so people did speak to, wanting to make sure that they're able to get a doctor, or how long it takes to be able to get that sometimes. But overwhelmingly, we're hearing that people enjoy the access they have, and they want to be able to have better access. And so there are several other bills that the Protect Our Healthcare Coalition is supporting this year, many of which have zero costs to the state, that are designed to help improve people's access to affordable health care. For example, a bill to remove prior authorization requirements when your primary care physician is the one doing the referral. And that's designed to both reduce administrative stress on primary care physicians so they won't have to retire, and so that we can increase our population of primary care physicians in the state, and also so that people don't have to wait for weeks upon weeks to get health care that their primary care physician is saying that they need. There are other proposals like reducing medical debt, which we hear in community and in research makes people want a delayed treatment. If they have medical debt, they're less inclined to go to their next doctor appointment because they may not be able to afford the copay and don't want to go further into debt. So we do hear stories like that from the community too. And all of that essentially lets me know that people need this. And if this health coverage via Medicaid were to be reduced or go away, we'd see much more hospitalizations. We'd see much worse health outcomes, and we'd see people having to make really difficult choices between food and medicine, rent and medicine, and things like that. Those are also stories that we have heard in community, people having to make tough choices about what they can buy or purchase in a given month. And so certainly we can't afford for that to get any worse for the community.
Thank you. Okay, so I'm gonna I understand, Congressman, you only have a little bit more time with us. So I have two questions for you back to back that I think they should be pretty
Sure.
quick. So a lot of us are hearing rumblings of the electoral landscape. Are there there are two special elections right now that people are aware of in Texas and Arizona, possible swing vote specifics. Pressure points is a question from Pat Ford. And then another question from one of the folks on the call is just folks are really scared about what happened to Anchor Health. And so, is there anything maybe from the framework of treasurer, former treasurer, that you could answer something about both of those before you go?
Yeah. So I'll take the second one first. The situation with Anchor Health is obviously terrible. 25,000 people, are at risk of losing their primary health providers. We've been in touch in our office with providers at Anchor just to get a sense of what's going on, and I think it's a mixed bag. I think some of those doctors are going to retire or going to move out of state, but there are others that are looking at setting up their own practices here in Rhode Island or maybe jumping into a different practice here in Rhode Island. So it's messy, but I would just say that if you're caught up in this, talk to your doctor directly and ask them what their plan is. And if they're not planning to stay in Rhode Island or they're still figuring it out, they may be able to refer you to somebody else. Um, but we have a larger structural issue here, right? Which is that doctors don't get paid as much in Rhode Island as they do in other states. And there's a couple of reasons for that. Um, One reason is that through Medicaid, which is what we've been talking about a lot today, the state doesn't reimburse doctors at as high a rate as other states, neighboring states do. And there's a couple reasons for that. I think one reason is just that, historically, Rhode Island has had a tougher budget situation than our neighbors. We've also prioritized covering I think the General Assembly has prioritized covering lots of healthcare services under Medicaid, sometimes at the expense of paying providers a competitive rate for the services. Like in an ideal world, you would have enough revenue where you can do both. You can pay doctors well and have really good health insurance coverage under Medicaid. But in Rhode Island, I think we've sometimes prioritized the breadth of coverage over the payments to the providers. That's a policy decision. It doesn't have to be that way, or doesn't have to be a binary choice either if you have more revenue. Um, but that's the reality up until now. And then on Medicare, which is all federal government, there's a very convoluted Medicare formula under which Rhode Island doctors also get paid less than in Massachusetts and Connecticut. I will tell you, Jack, Sheldon, Gabe, and I, like, we are very focused on the Medicare issue, and we're trying to find any point of leverage that we can in Congress to get a fix for Rhode Island. We got a partial fix a few years ago that bumped up the payments for Rhode Island a little bit, but still not to parity, which is where we need to be. Um, so we'll keep at it. We'll keep working on it. There's a federal component and a state component. But in the meantime, if you're caught up in the anchor situation, I would just say talk to your provider and ask them what they plan to do. As far as elections go, so we had, from my point of view, a tremendous win in Wisconsin a couple weeks ago. Hugely important state Supreme Court race. Hugely important for a lot of reasons, like reasons that are specific to Wisconsin, but also reasons around redistricting and reasons around honoring future election results. So a huge win, but it was especially a huge win because Elon Musk and Trump went all in on that race. Like Elon dumped $25 million of his own money in. He went to Wisconsin and like jumped around on the stage like an idiot and like gave away $1 million checks to people for voting. And still like they got their butts kicked by 10 points in a state that Trump had just won. So that was very heartening. And even in these Florida special election seats where Democrats came up short, like our candidates lost by something like 12 points in district won by 30. So so those are some good early indicators. As far as upcoming special elections, there are two, one in Texas and one in Arizona. They are both in seats that should be safe blue seats. So just to be candid, and I'll probably get in trouble with some of my colleagues for saying this, but like I'm just going to be straight with you. Like don't spend money on those races. Like if you're looking for places to like stress donate to, I wouldn't do those. Like I just like they're safe blue seats, we'll be fine. Um, but if and when there are other special elections that are competitive or are important, I will let you all know. I will use my social media platform and my email list and my contacts with groups like yours to get the word out. Um, there are some of those races every cycle. There will be more this cycle. There aren't any pending right now, but when they come, we'll let you know.
Congressman, I know you need to go. Are you able to stay for a few more minutes, Nina, with a few more questions? Okay, so before you go, Congressman, I just want to say thank you. I appreciate you taking the time with us. And I want to say with him in the company with you all that we know he has had our back. He's working as hard as he can, but it is up to us, his constituents and his constituents peripheral, that we should continue calling his office. We need to show thanks. We need to put thank you messages in as much as not, because that kind of data set goes far. And we also want to continue thanking folks for the work they're doing and continuing to communicate with them when we are feeling concerned and saying, how can we help? There will be ways here on the ground. From a federal perspective, it's a little harder for us to get down there as Rhode Islanders to show up. I keep dreaming of like another bus run like we did in 2020.
Do it.
But yeah, we'll coordinate. But anyway, so thank you for taking the time with us, sir, and we will be in touch soon.
Sounds good. Thank you all for
Thank you.
organizing this.
Thank you. Okay, Nina, so I have two more questions for you in the vein of taxing the rich bill. And also, we'd like to just hear a little bit about SNAP because we referenced it and we haven't really talked about it. And yeah, so I would love to hear from you. One question from Pat Ford as well is, are there any specific legislators you see as swing votes on the tax the rich bill? I know it gets really specific. So, oh, wait, I may have to, sorry, I have to do it's a security setting. Sorry, folks.
Um, I think that's harder for me to say, and perhaps strategically, I might not want to say.
That's fair.
But I think ultimately what people should be doing is showing their support for this bill widely. That means, like Congressman Magaziner said, get loud on the internet. Today, the campaign is having a social media day of action to promote this bill to tax the top 1%. So we're asking people to share your pictures and your videos from the protests where people were chanting tax the rich, to sign our petition, which Jocelyn put into the chat here, and to share the petition online. We are going to be delivering that to the General Assembly once we've gotten as many signatures as possible. What that means is talk to your friends about the bill, call your state senator and representative, and tell them that you want this bill to pass and ask them to speak to leadership. Ultimately, the Senate president and the Speaker of the House do have tremendous influence. And so, to those who have the Speaker and the Senate president as their state representatives, please call them and tell them that you support this. If you have a relationship with the governor or you want to make your voice heard, I would suggest that you reach out to the governor as well. I think it's really important that the most influential people who are in leadership know just how many Rhode Islanders support this. So we do invite you all to participate in our social media day of action and to spread this message far and wide. Rhode Island needs this money, and if we don't get it, services will be cut. Whether that's Medicaid, whether that's enhanced premium tax credits, whether it's RIPTA roots and services, whether it's childcare, whether it's prolonging the repair of the bridge, whether it's adult education funds, whether it's SNAP, which 144,000 Rhode Islanders rely on. That's more than 1 in 10 Rhode Islanders who use SNAP to ensure that they can get nutritious food that they need for their families. So this bill is important, and there are a myriad reasons why it's important. I ask you that you call your state representative and tell them why it's important to you. You can tell them what program you think this bill should fund with the 190 million, what services you think absolutely can't be cut, and tell them this is how they can pay for it. They just need to hear that from as many people as possible.
Thank you. That's such a good ending. And yet, I do want to respect Rep. Tanzi's question that she put in for you, which is There's talk that the Tax the Rich bill hits people with incomes as low as $425,000. Can you explain that it is a 625,000 only taxes dollars at the new level above 625 and $1?
Absolutely. Thank you for that question, Rep. Tansey. That I have no idea where that rumor has come from, but there is absolutely no bill that I know of that taxes, at least in Rhode Island, proposing to tax income at that level. This bill exclusively taxes income above $625,000 per year after deductions. It absolutely does not touch income below $625,000 per year. So this would just be a 3% surtax on income beginning $625,001. So any income above that would be taxed at an additional 3% surtax. Any income below $625,000 per year would not change at all under this bill. So we think that's a pretty high bar. It is exactly the 1%, the top 1% of income earners in Rhode Island. And again, it is only taxing income above $625,000, and that would only affect 5,700 tax filers. So a very low impact for a high reward that everyone would benefit from, including those high income earners. They also need the bridge and roads and childcare and things like that, that this money would go towards being invested in.
Thank you so much. Well, I'm going to end it there. If you have additional questions, Nina, do you mind sharing your email address in the chat for folks to reach out to you? And I will just say thank you for being here. I want to say in Rhode Island, Medicaid covers so many things related to bodily freedom. If you care about gender affirming care, this is your fight. If you care about abortion and other reproductive health care services, this is your fight. If you care about feeding children at schools, this is your fight. If you care about health care for facilities staying open and affordability for elderly and non-elderly alike, this is your fight. If you have a loved one in a nursing home or receiving in-home care, this is the fight. And if you're worried about the cost of your health insurance, this is your fight. Everyone on this call, we all need to send messages to everyone that will listen that no one should have to have their health care taken away, and no billionaire should continue to avoid paying their fair share in taxes. It's pretty straightforward. This is a pathway for us to exist. And frankly, there's so many models across the country that have shown us this fact. Rhode Island can do it too. So thank you for being with us. We will follow up in an email today to all of you with a few of these resources. And we will put it in our general email going out as well, the recording, if there's anything you want to share with folks. Thanks again, folks. And Nina, thank you so much for taking your time today, and good luck with all your massive range of activities. It's so exciting. I can't wait to do them.
Thank you, and thank you for your help. I look forward to seeing you all online for the Social Media Day of Action to tax the rich, tax the top 1%.
Thank you. Take it easy, everyone, and be well. We'll talk soon.
Bye-bye.
Bye-bye.